Today on Cancer Buzz, ACCC's recent oncology reimbursement meetings and how we can optimize insurance for uninsured or underinsured patients. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. ACCC's Oncology Reimbursement Meetings, or ORMs, were designed to help cancer professionals navigate changes in the reimbursement and regulation landscape. On the show today is Jordan Karwedsky, a financial counselor at Bay Oncology in Green Bay, Wisconsin. Karwedsky is part of the ACCC Financial Advocacy Network Advisory Committee, and at the recent ORMs, she taught cancer care team members what to do during open enrollment to make sure their patients receive comprehensive cancer care.
So for Medicare, open enrollment begins October 15th every year and runs through December 7th. So that's the time frame that patients who have Medicare are able to add a supplement to their coverage. If they want to switch to a Medicare Advantage plan, that's the time they can do it. They can add and switch Medicare Part D plans during that time period as well. And any changes that are made between October 15th and December 7th are effective January 1st. For the healthcare marketplace, that open enrollment period runs November 1st through January 15th. So if a patient enrolls in a marketplace plan by December 15th, they will have coverage that is effective January 1st. After December 15th through January 15th, the coverage will be effective February 1st. And then if they try to enroll after January 15th, the open enrollment period is closed and they'll have to wait until November 1st.
How can care teams offer support to patients who don't have insurance?
If you have a patient who is uninsured or underinsured, make some sort of note or reminder for you so that when we get to November and open enrollment starts again, that you can reach out to them and really help them optimize their insurance. But in the meantime, if they are in need of treatment, working with the drug company programs to try to save them as much money on their treatment. If the manufacturer is able to supply the medication for them, great. If your facility has a community care or charity care program that they can apply to help with some of the other out-of-pocket expenses, that's always a great option too, depending on income, if they can get screened for Medicaid, if that would be something they qualify for as well.
What about the EMR? How can cancer centers and programs make it work for them and automate authorization tracking?
So if you work in Epic, utilize work queues, set rules in your work queues so that the referrals fall back in. If there are changes made to a patient's treatment plan, things are added, things are removed from the plan, doses of medications are changed, cycles are added. They can fall back in if there's an insurance coverage change. So that's a big one to make sure that you're not missing authorizations if something in the plan has changed or a patient's insurance has changed. You can also set rules that they fall back in within a certain time frame prior to the expiration date, so you don't miss anything that's expiring as well.
Give us some highlights of some recent ORMs.
I think some highlights for me is how to work with your legislature, whether at the state or the federal level, advocating for patients and laws that help them. There was great information on coding and billing for care management for patients who have chronic diseases, if that's something that your facility can do. There was talk about radiation oncology, which and some of the issues and struggles they see with that and with authorizations. And I think that's something more and more that ACCC is getting involved in, and we're starting to hear more about through ACCC. And then, of course, there's always new financial counselor advocacy navigator programs that clinics are starting up and, from one person, and how do I build this into a program? I can't keep doing it myself. So also great information about helping your patients navigate through open enrollment for marketplace insurance plans as well as Medicare and helping them optimize their insurance for the new year.
What can participants learn from attending this session?
Key takeaways would be the importance of helping your patients who are either uninsured or underinsured optimize their insurance for the new year. And then we also talked about how to manage those insurance changes in your clinic, where the notification is coming from, and then handling the prior authorizations that come along with those insurance changes.
Thank you, Jordan. You can head to the show notes for information on ACCC's upcoming ORMs and resources to optimize insurance. Finally today, if you're listening to the show on Apple Podcasts, the platform paused all its shows for regular listeners recently. You can go to the Cancer Buzz channel on the app right now. In the top right corner, hit the plus sign or the downward arrow to make sure you're following the show and will get the latest releases when they drop. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.